We're all used to shopping for value for major purchases. We try to choose things that offer high quality at a fair price. It's what we want for our healthcare too, but knowing how to find high-value care isn't always easy. When it comes to value in healthcare, receiving high-quality care, having a good experience, and not paying too much for your care or for care you don't need are all part of the equation. Let's meet 3 savvy healthcare shoppers to help show us how it's done. Olivia is looking for a high-quality primary care provider. First, Olivia compares care by using the Community Checkup website to find out how providers in her network rate on quality measures. Then, she makes an informed choice. By comparing scores, Olivia finds high-scoring providers in her neighborhood and contacts them to see if they'd be a good fit. Once she's in the exam room, she makes sure she gets the right amount of care, not too much and not too little. But quality is only part of the story. You also need to feel respected and listened to, and that you understand the care you are getting. This leads us to Michael and step 2 in the search for value. Michael wants to make sure he is getting the care he expects and deserves every time he goes to the doctor. Michael expects to be able to get an appointment in a timely manner when he needs care, to have a doctor who will listen to his questions and give him answers he can easily understand, to feel respected by his doctor and office staff, to have a doctor who knows his medical history, to get regular reminders for care and follow-ups with test results. First, Michael makes sure he has a primary care team that is committed to an excellent patient experience by going to the Community Checkup to see how his provider scored on the latest patient experience survey. Then, he does his part by coming to his appointment with a list of questions and ready for discussion. He makes sure he understands what the doctor is saying before leaving. Finally, Michael knows he has options. If his expectations aren't being met, he talks with his doctor about his concerns or looks around for a new doctor. High-quality care and a good patient experience are key, but we also deserve care at a fair price. This leads us to Anne and step 3 in the search for value. Anne wants to make sure she gets the care she needs without paying more than she has to. For other major purchases, she knows how to figure out if she's getting good value. For healthcare, she should do the same. First, she makes sure all her providers and hospitals are in her health plan's network so she can get the best rate possible. And she uses her health plan's cost estimator or customer service line to learn what a recommended procedure might cost. Then, she asks questions about the procedure and related tests and medications. Finally, she makes sure she uses the ER only for emergencies. Some settings of care are more expensive than others. She uses her primary care provider whenever possible. High-value care is the right care at a fair price with you as the patient at the center. You have the right to demand high-value care at every step. Learn more at www.wacommunitycheckup.org.